The key points were our organisation, like ours, an NHS trust, that is growing very quickly, both in its size, its complexity and its financial arrangements. What are the problems associated with that growth, and how can you manage those to get efficiencies while still keeping patient safety at the top of your list? I think the key problems associated with that growth are, first and foremost, to engage the staff, because initially the staff will feel threatened. They're not sure what the future is. They're coming into a new organisation. Will they have a job? Things like that. And it's very difficult to get the message out to them that certainly frontline services, they are going to be protected. We are all about improving services to patients, not threatening that. And I think once we got that message out to some of our staff at the front line, we got the cooperation we needed to go forward. We have, however, been able, and we all talk about making savings from back office savings. I think we are probably one of the organisations where we can actually prove that that can be done, and can be done relatively painless. Well, in Bridgewater, I've got to go back to Ashton Leon Wigan NHS Trust. We was back in 2007. We was one of the original 6 pilot community trusts chosen by the NHS. So we've worked since then to develop community trusts. So we've been at it now for quite a long time. And we separated from the PCT in 2009. We became an autonomous trust then, with our own finances, our own board and our own financial records and bank accounts. So I think we've been at it a long time, and a lot of the new community trusts are only just coming on stream, and there's a lot of learning, I think, that is available. To some of the provider organisations, I think we need to network more, and this has been a start at this conference. And I think hopefully some of the contacts we'll make today will enable us to do that, because it is true on the community trusts that people do not know who is available. That we are very isolated, we're ploughing our own furrow, you don't think anybody else is doing this. And the great thing about it is when you realise that there are other people in that you can share good ideas and bad ideas with. So I think networking, it's an overused word, but it's one that is important. Community trusts and community provision has been the Cinderella of the NHS for such a long time. And when you look at how much money annually is spent in the community, how many people's lives the community touches, I think that's surprising. And it's only now, hopefully, that people are beginning to look at what they do in the community, and most importantly, how it can be done better and more economically. A lot of other community providers have now gone into mental health trusts, and we don't normally meet with those organisations, and this has given me an opportunity today to use the word network, to be able to make contact with them. And I think they, as much as anything, don't even know that we are there.